Good morning. My name is Leonard Schaeffer. I'm the chairman of the Roundtable on Quality Care for People with Serious Illness, and I'd like to welcome you to this workshop today. We have an awful lot of people signed up and people watching online, and I think it's going to be an excellent opportunity for all of us to learn something. I have been told that I have to say the following, which is the Roundtable serves as a convening opportunity for a broad array of stakeholders, government agencies, foundations, professional associations, patient advocates, healthcare providers, researchers, insurers, and health plans. I won't ask you to raise your hands, but that's basically who we have here. We are trying to drive progress toward providing high-quality person-centered care to people of all ages living with serious illnesses. Now, that's the paid political announcement. Here's the announcement for the people who paid. Magically, we want to say thank you to the Gordon and Betty Moore Foundation, who supported the effort that led to our workshop today. These are fine Americans located in California, I would note. Nothing personal, but I happen to be located in California. But they do a very good job. However, we have to thank everybody. Whoops. I do not have any idea how this works. There you go. We want to thank everybody who has been supporting our effort. We're going into our third year here and appreciate the financial support from all of these fine Americans. I have now exhausted just about everything I know on this topic. And so I want to introduce the vice chair of the Roundtable, who actually knows something about the clinical aspects, James Tulsky. And James got a haircut for this meeting today. So.
He's actually right. The other day I realized it had been 2 months, so it's about time. I would like to start by reinforcing the thanks to the Moore Foundation, first of all, which is sponsoring this conference. They've been doing a tremendous amount of work thinking about measurement, and this is one piece of a larger, broader sort of agenda to improve measurement in our area. There was a really important conference that was held in Banff last year, and so I think, and I'm really thankful to them because it's maybe the less sexy piece of what we do is this idea of sort of how do we measure it, and yet as we all know, if you don't measure it, you can't improve it, and in this area it is very, very difficult to measure. And so therefore it's important that we talk about this, that we really think deeply and make sure that we understand what we're doing. I would also like to thank the co-chairs of this conference. It would never have happened without them. So Amy Kelly, who is Associate Professor and Vice Chair of Health Policy at Mount Sinai Icahn School of Medicine, and Amy Melnick, who's Executive Director for the National Coalition for Hospice and Palliative Care. Grateful to both of you. Putting on a conference like this is not easy. I'm looking around at some other people who have done that before, and they know what it is like, how much work goes into it. And speaking of all the work that goes into it, the person I want to give very special thanks to is Lori Gregg, who without her, honestly, nothing here would really happen. And certainly conferences like this would not happen. And to her and her staff that does simply a remarkable job, Salara, others, and allowed all of this to happen. So we're really, really grateful. And so with no more ado, I will hand it over to Amy Melnick. Thank you.